Hello, I'm Dr. Yu. Today I'm here to discuss about clinical exam, especially the clinical exam of intermediate module, that is the TOACS, task-oriented assessment of the clinical skills. Before starting this presentation, I would like to congratulate all candidates who cleared their theory exam and doing practice for the clinical exam. So we'll briefly discuss the structure of the TOACS exam and intermediate modules. There are 12 stations. All or most of the stations are interactive, where you can perform with the examiner or a simulator, and each station lasts for 7 minutes. For TOACS preparation, it's important that you should know what are the different areas that can be assessed and the clinical exam of IMM. The area which are important include the examination and examination, the certain examination from the mental state, which include the phenomenology or the assessment or mental state for the psychosis, the Schneiderian clustering symptoms, the assessment of the depressive symptoms, the examination which are important, and neurological examination, especially the cranial nerve, motor and sensory examination, the lobes examination, Wilson disease examination, which is actually a combination of different systems, which includes the general physical examination, examination of the motor system, abdominal examination, and the endoscopy. The second area that you should familiarize yourself for the TOEFL exam is investigations. This include psychometric tools, the common psychometric tools for depression, anxiety, OCD, psychosis, and sometimes they give psychometric tools for the assessment of personality like TAT or the shock. The other investigation include the EEG, CT or MRI, CSF analysis, and urine analysis. There are also other investigations as well. They sometimes test, but these are some of the common investigation you should know. Non-pharmacological interventions are also tested in IM talks. This include the cognitive behavioral therapy for depression, for panic disorder, CBT for psychosis, the exposure and response prevention therapy is also tested, progressive muscle relaxation exercises, and other non-pharmacological interventions. There are some stations related to assessment for the substance use, assessment for depression, assessment for psychosis, anxiety, borderline personality, antisocial personality, and risk assessment include the risk of suicide, homicide, and deliberate self. You should get familiarize yourself with these stations as well. They also test your knowledge regarding the informational care regarding the common psychiatric illnesses, and the informational care regarding certain treatment like clozapine, lithium, or electroconvulsive therapy. In management station, there are some stations related to particular cases like prescribing antidepressant to a lactating mother, or management of the toxicity, or management of the escalation in the war. These are also important. And the area of research, they either test your knowledge regarding critical appraisal, they give you an article and you have to do the critical appraisal. And sometimes they give the graphs, especially the Polish plot is important. You should memorize yourself with that as well. Physical treatment, as I mentioned, the ACT, the evidence-based medicine includes the guidelines from the Maudsley and NICE guidelines regarding specific treatment like stepped care approach for OCD, stepped care approach for the depression. So these are the some of the areas which are tested in the intermediate module clinical exam. You should know these areas. So how to prepare for the TOACS exam? For this, you should have knowledge as this exam is done after the 2 year of training and you cleared your theory exam. So you have a good level of knowledge from Oxford, Kaplan, the behavioral science and the Maudsley guideline. So that won't be a problem for most of the candidates. Practical resources, we have lots of practical resources like the book from the our local settings like the Ramazan book, the book from the Dr. Asghar Sheikh, the Anamada, and there are also other practical resources, past papers or past talks. We can use those resources as well. And after reading from the practical resources, you can practice with your colleague and in front of your senior and get feedbacks from them. And it's important at this point because this might be the first time that you are performing under the supervision and sometimes we get critical to ourselves. So I recommend you be gentle with yourself. If you are not performing well, then it's okay. It is just an exam, and with practice, you will make this exam easy. And don't be overcritical with yourself. In the exam or in the mock, first of all, you have to identify the area of station, whether this station is related to assessment, whether this station is related to history taking, is this examination. So you should identify the areas of station. And we know that from the each area, there are multiple stations. And you should have mental sketch for the each areas. For example, in case of management of toxicity, we should have a sketch like in case of managing toxicity, lithium toxicity or PCA toxicity, we have to make the medical condition of the patient on priority. So in that case, we have to first of all do the airway, breathing and circulation check and stabilizing the patient uh, on the basis of these airway breathing and circulation. Thereafter, we can decide whether this patient should be placed in psychiatric ward or medical ward. In cases of toxicity, as the medical condition is priority, we usually keep these patients in the medical unit. Thereafter, we advise immediate investigations like if the patient is suffering from having TCA toxicity. In that case, we do certain investigation. The specific investigation, which is very important, like we should remember the ECG and the other baseline investigation as well, and the this. And in case of TCA toxicity, the assessment of the risk is very important because sometimes patient take the TCA for the purpose of attempting suicide. So you should have a basic structure for each station. And with that, this exam and the practice will be easy for you. So I hope this short description how to perform, how to prepare for the talks will be useful for you. I'm wishing you good luck for your clinical exam. If there's any question, kindly feel free to ask. Thank you for listening.